Good afternoon. Thank you for joining the Justice and Mental Health Collaboration Program 2016 Technical Assistance Orientation Webinar. The JMHCP program is a very important initiative to help reduce the prevalence of individuals with mental illness that are in our criminal justice system and to promote further collaborations between organizations in both the criminal justice and mental health systems. After brief presentations by our speakers today, Maria Fryer and Nikisha Love from the Bureau of Justice Assistance, or BJA, and Richard Cho and myself, Sarah Wurzberg from the Council of State Governments Justice Center, there will be time for a question and answer session. To ask a question, please type the question into the question and answer panel on the bottom right-hand corner of your screen. We will do our best to answer all of your questions. If your question does not get answered during the webinar, please follow up via email after the event has ended. At the end of the presentation, we will provide email addresses for everyone speaking today. If you encounter technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues that may not be able to be resolved. For this reason, we are recording this event, and we will be emailing the recording to all of the attendees as well as posting it to our website later this week. Starting off the webinar today, we will have a welcome by the Bureau of Justice Assistance staff, information about the current round of grantees, as well as discussion of the budget process. Following this will be a short presentation by the Council of State Governments staff on technical assistance, what we do, and we will then conclude with time for questions and answers of both BJA and CSG Justice Center staff. I will now turn things over to Maria from the Bureau of Justice Assistance.
At BJA. As policy advisor, I oversee this program as well as other policy initiatives that help states, tribes, and local government to improve outcomes for justice-involved people with mental illness. Before coming to BJA, I worked in a number of government capacities at the state and local level and understand the challenges you face, not only working with this issue, but also the responsibilities that go with managing a federal grant as well. So with that, we've got to first open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing grant funding in an incredibly competitive year. You represent the top 24% of applicants in 2016. Your applications were screened for basic minimum requirements, were reviewed, rated, and scored by panels of external peer reviewers, and after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So, congratulations on your award. As recipients of this award, you each share a common goal to effectively serve people with mental illness in your local jurisdictions and to create positive, system-wide change for justice-involved people with mental illness, alongside many other professionals across the nation. So let's look at who is in this group. In total, we received 131 applications in 2016, and we're only able to make 31 awards this year, representing 18 states and the District of Columbia, 6 of which are in the Collaborative County Approaches category, 16 in planning and implementation, and 9 in the expansion category. This includes 9 corrections-focused grantees, 8 law enforcement grantees, 5 grantees specializing in general community-based mental health or co-occurring reentry services, 2 courts grantees, and 1 juvenile justice grantee. Next, let's talk about expectations. Since each program was reviewed and selected based on criteria that uniquely qualified them as most competitive, I want to lay out some very specific expectations that we have of you. We expect that you will serve the number of people you proposed within your application, and that you will actively take measures to seek appropriate services for the targeted population or services designed to meet the needs of the population you serve. We also expect that you will use evidence-based risk and needs assessment instruments to accomplish this, that you will incorporate evidence-based trauma-informed treatment practices and interventions into your services and into your justice system response as a whole, that you will seek help when help is needed and communicate regularly with your technical assistance coaches and BJA staff to include your program manager or myself, your policy advisor. An example of a good time to reach out to me if you need to make a programmatic change, so I can help you navigate between both technical assistance to make a good change and the program's office to ensure that the budget follows. This grant project is yours, and sometimes changes are required to be successful. This is not a negative reflection on your program. We just want to be smart about it and make the best out of your situation. Next, what do you expect from us? You can expect that we will support and assist you as you set out to reach the goals of your program. We want you and your staff to have the necessary tools to serve critically underserved populations for the betterment of the communities where you live. Both the program staff and policy staff will be responsive to your inquiries as they arise, whether they are technical, about allowable uses of funds, changes in key staff, requesting no-cost extensions, or whether they are regarding key changes at the state, county, or local level that you foresee potentially impacting your program. We will provide quality technical assistance through the Council of State Governments Justice Center. So a little bit more about the Council of State Governments Justice Center. They really brought to light the need to better serve people with mental illness in the justice system through their landmark work of the Consensus Project. Since then, there have been numerous accomplishments to improve how we, as professionals, work with justice-involved people with mental illness, and they have been a long-standing partner of BJA and the technical assistance provider for JMHCP grantees since the inception of the program. So you're in good hands. Each of you will have a TA coach assigned to you by the Justice Center, and we expect them to call you, email you, challenge you, and support you. Overall, considering everything shared so far, what we are trying to achieve are better outcomes for people with mental illness in our systems. Specifically, we're looking to reduce recidivism rates and fewer jail bed days and improve functional outcomes for such as the attainment of stable housing, opportunity for employment, long-term employment, and fewer hospitalizations. We've revised our performance measures so that we are asking you for the data and ways that can best capture this information. In order to continue this work, we must have the information to communicate to stakeholders about what this program is accomplishing, how it is affecting change, how grant funds are used to accomplish this change, and report the results. We also look at performance data to make program improvements along the way. So about us. Next, I want to tell you about the Bureau of Justice Assistance. As I mentioned, I work in the policy office at the Bureau of Justice Assistance and oversee a number of programs pertaining to the intersection of substance use and mental health within the criminal justice system, including this program, the JMHCP program, along with other policy initiatives that pertain to this issue. Just recently, as you may have heard, we launched the Police Mental Health Collaboration Toolkit, along with the Justice Center and the International Association of Chiefs of Police One Mind campaign. We are a small staff dedicated to translating best and promising practices into quality policies and programs for the criminal justice field. Also within BJA is the Programs Office. The Programs Office manages the individual awards that each of you have received, and as such, you have been assigned a grant manager, either Nikisha Love Weaver or Veronica Munson. Nikisha and Veronica will be your contacts within BJA who can answer all your questions pertaining to allowable costs, management of the award, and reporting. We work closely together to ensure that all JMHCP grantees remain on track with their awards. With that, I'm going to turn it over to Nikisha, who will talk about the budget approval process, accepting your award, financial clearances, and other grant management issues. Thanks and good luck. Nikisha?
Good afternoon. At this time, I would like to say congratulations once again for becoming a 2016 Justice and Mental Health Grantee. Along with myself and Veronica Munson, we will be your contact, your grant managers to oversee the program for the next upcoming years. At this time, I would like to take the time to speak in reference to budget approvals. OCFO is still currently working to resolve any budget issues to oversee the budgets for approval. So we have not received any updates as of yet regarding any budget approvals. If you have received the budget approval, you will receive an automated email from GMS stating that your budget has been approved. Just take note that although the budget may have been approved, you still need to make sure there are no outstanding special conditions. We ask that you look over the grant award. The actual grant document is the document that the authorized representative signs. Page 2 is where the special conditions begin. Please make sure that you read all the special conditions to ensure that there are no extra withholding conditions. Reporting requirements. Reporting requirements, the PMT reports, which is the performance management tool reports, are due quarterly. So the next report should be up and due in January. That first report will be due in GMS. That report will be due in January as well in GMS. All reports after that in GMS for programmatic only will be due semi-annually. Financial reports are due quarterly as well. Even if you have no project work done, you all have not implemented anything, no work was done, you still are required to submit reports on time. In the event that your budgets are approved and there are no extra withholding conditions, if these reports are not submitted on time and timely, this can hold up your funds. Drawdowns. Please make sure, again, that all withholdings have been cleared before you can access or draw down any funds, and that the financial point of contact has been authorized and submitted in GMS to be able to access for any drawdown. We ask that we do segregations of duties that not one person can control the entire grant, that you should have 3 different people working in 3 different aspects of the grant. You have the point of contact, which is for programmatic. You have the authorized signer, who can sign for any monetary awards, and then the financial point of contact, who oversees the finance. We ask that 3 different people be listed under each of those duties, and that all contact information is up to date so that we can reach out to you in the event that we need to contact you, and any information that's sent through GMS will be sent to those contacts that are listed in GMS. So please make sure that all email addresses are up to date and phone numbers. Contact information, you will find my information, Veronica's information, and again, your information. It is very imperative that we have all contact information for the grantees because things do come up. We need to reach out to you. So please ensure that all of the contact information is correct. Any questions that you all may have in regards to your special conditions, in regards to your budget, please contact myself or Veronica Munson, and we can assist you with that. Again, I would like to take this time to say thank you, congratulations, and we look forward to working with you. At this time, I'm going to turn it over to Richard Child, at the Councils of State Government. Thank you again.
Great, thank you, Nikisha. This is Richard Cho. I'm the director of our newly formed Behavioral Health Division for the Council of State Government's Justice Center. And I wanted to take a few moments on today's webinar to do a couple of things. First, to just formally introduce you to the CSG Justice Center and tell you a little bit about our work, and also to pile on my congratulations to you all as recipients of the FY16 JMHCP grants. Just a little bit about who we are. The Council of State Governments, or CSG as we are known, is a national nonprofit membership association that represents state policymakers from all three branches of government. That includes governors, state legislators, as well as the members of the judicial branch, judges. The Justice Center, which was spun off as a somewhat separate organization in 2006, provides practical, data-driven guidance and advisement on criminal justice policies and practices, and we work at the federal, state, and local levels to do that. Our work spans everything from efforts like justice reinvestment, where we're working to advise governors and state legislators on policy strategies that are intended to curb prison growth, as well as figure out how to redirect resources towards programs and practices that will help keep prison populations low, to our work as the Department of Justice's selected provider of training and technical assistance under the Second Chance Act. The division that I have the honor to lead, the Behavioral Health Division, focuses specifically on how to improve outcomes for people with behavioral health needs who come into contact with the criminal justice system. Broadly stated, our focus is on two things. First, we're working to help states and counties to implement the kind of policy reforms, practices, and programs that will help reverse the overrepresentation of people with behavioral health needs in the criminal justice system, and frankly, to stop using jails as our de facto mental health system. And second, because we know that some criminal justice involvement is going to be inevitable for people with behavioral health needs, we can't divert every single person. We also want to ensure that when law enforcement and criminal justice agencies come into contact with people with behavioral health needs, they, working with their behavioral health partners, have the capacity to appropriately respond to them to reduce their harm and to improve their health and public safety outcomes. That work spans everything from the Stepping Up initiative, which you'll hear about later today, where we've had now more than 300 counties across the country signing up and passing resolutions to stop using jails as their de facto mental health system, to work that we're doing to improve the capacity of law enforcement agencies to more appropriately respond to people with behavioral health needs. You'll hear a little bit later about a police mental health collaboration toolkit that BJA launched a couple of weeks ago that we helped contribute to. I wanted to congratulate you more formally. I know some of you received a letter from me on your award, on your FY16 JMHCP grant award, and I want to thank you for your work. As a recipient of this grant, you've taken on yourselves the task of tackling what I think is one of the most important policy challenges of our time, which is the mental health and behavioral health crisis in our criminal justice system. With this grant, you have the opportunity to help reduce escalations of violence in contact with law enforcement for people with behavioral health needs, as well as to reduce avoidable tragedies that involve those situations, and also to create as many opportunities as possible to divert people with behavioral health needs from jails who pose little to no criminogenic risk. And finally, to improve connections to treatment, services, supports, and housing at reentry for this population. This is not easy work, but it's critical, and we're really proud here to provide you with assistance and support. And I look forward in the coming months to hear more about your progress and about ways that we can further help you and guide your efforts. So with that, I'm going to turn this back over to Sarah Würzberg, who oversees our JMHCP Grantee Technical Assistance and Training team at the Justice Center.
Great, thank you, Richard. And I also want to add my congratulations to all the grantees. Our technical assistance team is really excited to begin working with you. We will be working with you throughout the course of your Justice and Mental Health Collaboration Program, grant program, to ensure that you are meeting the goals of your program. Technical assistance can look a little bit different for different grantees. The main goal today is for you to have a little bit of an idea of what technical assistance could be like from the Council of State Governments Justice Center team, and to help you think about the resources that you can draw upon in your work. Over the course of the next year, our primary function is to help you achieve your goals you have listed in your grant application and that BJA has funded you to do. On your screen now are a few of the examples of what your technical assistance coordinator can do for you or reasons that you could contact us. We help to support your team's efforts through on- and off-site technical assistance. This would include monthly phone calls, identifying resources and access to experts in the field, supporting your team's planning and implementation through on- and off-site technical assistance, linking you to your peers for peer learning communities, webinars for the field and specifically tailored to JMHCP grantees, as well as site visits. Off-site technical assistance includes the monthly calls that I mentioned above, check-ins and emails from your TA coordinator to hear from you and your stakeholders and partners. For on-site technical assistance, we have resources to conduct a limited number of in-person visits to those grantees that have a situation that would benefit from an in-person consultation by the Justice Center staff and at times another content expert. Another thing we do is connect you with resources, such as research findings and practical tools, and experts, such as researchers and practitioners, who can help you resolve challenges you face in meeting your goals. Through the multiple technical assistance programs we manage, we're also able to connect you with individuals and programs that are in your shoes right now, or implementing programs similar to the ones that you've proposed. Through meetings, online resources on our website, small learning communities, webinars, and through our National Criminal Justice Initiatives map, which is linked to right here, you can look to see what other programs are within your state, your jurisdiction, that are implementing similar practices to your own. You can sort by what type of award that the grantee has received, the target population of the program, such as focuses on juvenile justice, adults, mental health, and you can also search within specific geographic mileage markers. So if you wanted to find someone specifically in your state or region, you would have that opportunity to do so. One great way to connect to resources is our monthly newsletter, which is a compendium of information on important topics on criminal justice and behavioral health collaborations in the field. It includes upcoming funding opportunities, webinar announcements, profiles of current and past JMHCP grantees and their milestones, important research, as well as links to a number of articles on criminal justice and behavioral health that appear in national newspapers, websites, and magazines around the country. You can sign up for the newsletter from any page on the Justice Center website. Your technical assistance coordinator and the Justice Center will hopefully keep you from reinventing the wheel and make sure that if someone out there is doing something similar, you know about it and can benefit from their experience and lessons learned. If there is research that is relevant to your program, we will connect you to it. If there is an expert who can help you troubleshoot a problem that you are facing and help you achieve your goals, we want you to have access to them as well. We are also here to make sure that you are not alone in the process of achieving your goals. Your programs are spread around the country, and sometimes even your team members are located in different geographic areas. We are here to make sure that there are others who are doing similar things. You can make sure you are in touch with them. With these things in mind, I'm going to talk a little bit about what your technical assistance can include. First, everyone will be invited to a JMHCP grantee orientation occurring in late winter or early spring of 2017. This is an excellent opportunity for your program. Experts from the field will be presenting. You will have the opportunity to meet with your technical assistance coordinator in person and network with your peers from around the country. Your technical assistance coordinator can help you determine which team members are most appropriate to bring to this event, and if you are having trouble deciding who from your program should attend. Your technical assistance your technical, in late 2017, there will be a larger event, a larger conference that all grantees will be invited to. Please follow the link under the picture on your screen for information on the 2015 conference, which includes PowerPoint presentations, videos of presentations, and audio recordings from that previous event. Second, your TA coordinator will be helping you work on a planning and implementation guide, which you will be receiving in the upcoming weeks. This is a structured process to help you think through some frequently asked questions and frequently encountered situations and challenges in implementing justice and mental health collaboration programs. Within the next week, you should hear from your TA coordinator about setting up an introductory call with you and your partners. It is not necessary to start completing the planning and implementation guide until you receive more specific direction and are able to connect with your technical assistance coordinator. The other piece is this year we are hosting a series of online groups events for learning communities. These will include gender responsive services for women, healthcare enrollment and other benefits, law enforcement, and research and evaluation partnerships. In these quarterly events, you will have the opportunity to more deeply explore these topics above and beyond your conversations with your TA coordinator, share experience with your peers on how you face challenges and obstacles in these areas, and have opportunities to hear from national experts in the field in these areas. Your TA coordinator will be reaching out to you shortly with instructions on how to join these learning communities. As you are all aware, the number of people with mental illness in the U.S. jails has reached crisis levels. In counties across the country, jails now have more people with mental illness than in their psychiatric hospitals. The situation is hurting real people, but communities, judges, police officers, mental health professionals, and others have started stepping up to combat the problem. The Stepping Up initiative focuses on a systems-level planning process. Launched in May 2015 as a partnership of the Council of State Governments Justice Center, the National Association of Counties, and the American Psychiatric Association Foundation. The initiative is designed to rally national, state, and local leaders around the goal of reducing the number of people with mental illnesses and substance use disorders in jails. Grantees may find this initiative complementary to their grant process as an opportunity to think through how grant-funded projects fits into the overall systems strategy to reduce the numbers of people with mental illness and co-occurring substance use disorders in jail. Free technical assistance materials are available through the Stepping Up website, stepuptogether.org/toolkit. To date, over 300, as Richard mentioned, over 300 counties have passed resolutions to advance the goals of Stepping Up, including some jurisdictions that are funded this year under JMHCP. To take action and learn more or review the resources in the toolkit, please visit one of the links on your screen, or you can also ask your technical assistance provider who can provide more information. In addition to the Stepping Up initiative, and in partnership with the Bureau of Justice Assistance, CSG launched the Police Mental Health Collaboration Toolkit last month at the International Association of Chiefs of Police Conference. The toolkit provides resources for law enforcement agencies to partner with mental health providers to effectively respond to calls of service, improve outcomes for people with mental illness, and advance the safety of all. The PMHC toolkit outlines the overall benefits of police mental health collaboration programs in 5 sections: learning about PMHC programs, planning and implementing, training, managing, and measuring. In addition to case studies, the toolkit supplements these case studies with steps to drive departments' planning, written sample policies, and checklists for decision makers who are seeking strategies for specialized training. For communities with existing PMHC programs, the toolkit offers tools, data, and procedures to manage the program and measure its performance, important steps for setting and meeting goals. A link to the toolkit is also on your screen. In addition to all these resources that I have just mentioned, the Justice Center website has a vast library of written documents, practitioners' guides, as well as distance learning opportunities. All these documents are free and downloadable from our website. We have a suite of publications on mental health courts, law enforcement and probation initiatives, a checklist for implementing evidence-based practice, our report on prioritizing scarce resources for adults being supervised in community correction settings, guidelines for successful transition of people with behavioral health disorders as they leave jail or prison. We also have law enforcement and mental health learning communities, as well as mental health and mental health court learning sites. We conduct a series of webinars over the course of the year on topics that have been requested by JMHCP grantees. There's also an archive of previously conducted webinars on a variety of topics that can be found under the resource heading on our website. Many of these include current and past JMHCP grantees as a feature. Recent webinars are on screening and assessment, data collection, developing phases of mental health courts, and trauma-informed care in criminal justice and mental health systems. In addition to those that are done by mental health programs, the National Reentry Resource Center also conducts monthly webinar series on similar topics, all of which can be viewed through the page on your screen. You will also have a customized technical assistance plan. You have already been assigned a technical assistance coordinator from the Justice Center who will be familiar with you and your team and your grant goals that you have outlined. You will work with this coordinator over the course of your grant period to identify relevant resources, troubleshoot questions that are coming up as you are working with your grant, and make connections with other programs around the country. Your TA coordinator will put together a TA plan talk to you about when it makes sense to check in and how they can be helpful. You will also work with your TA coordinator to identify whether or not your program is appropriate for an on-site visit. In addition to the planning and implementation guide, you will be sent a TA worksheet by your TA coordinator. It is a short 2-page description of what technical assistance includes, and also has a section where you can request specific types of technical assistance. So if you already know that there is something that you would like more information about or to connect with an expert about, it is an excellent way to address this and give your TA coordinator a heads up about your interests. You will receive the emails when your TA coordinator contacts you within the next week. Lastly, the slide shows an example of the main mental health website looks like, which addresses at the top of your screen. If you're eager to stay abreast about information in the field, in addition to our monthly newsletters, there's an In the News section link which will give you real-time updates on content compiled from daily and weekly news sources on criminal justice, mental health collaboration. I urge you to take a look at it, sign up for the newsletter, and explore the vast number of resources it contains for you to get additional information. If all things work as planned, when you close out of WebEx today, you'll be directed to a page on our website that will allow you to sign up for the newsletter. We encourage you and your teams to do so to start receiving this valuable information. We recently updated services for the emails, so if you're previous subscriber, you may want to subscribe again to make sure that you're receiving the information. I hope that this has been helpful in giving you examples of what technical assistance looks like from the Justice Center and some specific examples on the types of things that we do. At the end of the presentations, we will display our contact information. Feel free to email the appropriate person for additional information, either BJA staff for more fiscal and grant-related management issues, myself, or Cynthia Kimmelman-DeVries, who is the Deputy Program Director at the Justice Center, as it pertains to technical assistance issues. As a reminder, we will be emailing out the slides later this week, as well as posting the recording on our webinar page in order to archive it and so you can send it out to team members who are unavailable for this today. We will now begin the question and answer session. To ask a question, please type the question into the question and answer panel, which is at the bottom right-hand side of your screen. I will moderate the questions coming in from participants. We will do our best to answer as many questions as possible in the time remaining. If we run out of time, please feel free to email us and we will follow up with the information provided. So the first question we have is regarding drawing down funds. Is the drawdown amount for each drawdown flexible, or is it set by the grantor? Nikisha,
drawdowns are as needed.
As needed, so not set by the grantor, yeah. Correct?
Right, it's as needed. It's they can't come in and draw down the whole award. They can't do it that way. It has to be on an as-needed basis. So it's based off of, I guess, what you would say, the costs that have been allocated or for each quarter. Then they can come in and draw down. So it's as needed.
Great. Thank you, Nikisha. There's actually another financial question that has just come up. Can the financial point of contact be modified once it has been put into the system?
Yes.
Okay, great. Another question is, can we draw down funds prior to attendance at the orientation meeting?
If the budget has been approved. So only once the budget has been approved and there are no withholding special conditions, then they will have access to funding.
Great, thank you, Nikisha. I think there's a question that's more on the programmatic side.
I want to just jump back, this is Cynthia, folks, to the financial point of contact in GMS, which is very important. Nikisha had mentioned that there needs to be 3 people, a program-related person, the authorizing representative, and then your financial person. This isn't always clear to folks, but when you put in your application, you put in 2 points of contact. Sometimes that person is the actual district attorney or sheriff or a very high-level official that's in your jurisdiction. You must go back into GMS and make sure that the people that are in there are people that can actually receive email from BJA or from the GMS system that are actually related to the programmatic operations of your program, and not somebody who is necessarily oversees the entire jurisdiction or your county, which we understand that for application purposes was appropriate, but for the daily management of your program is not.
Thanks, Cynthia. One programmatic question we have is that, is the P&I guide mandatory and for which grantees? So the PMI guide is mandatory as written into the 2016 Justice and Mental Health Collaboration Program solicitation for Category 1, which is the collaborative county grantees, as well as the planning and implementation grantees. For the expansion grantees, your technical assistance provider will select specific sections that may be appropriate for you to do, or if it makes sense to go through the whole guide, they'll do that with you as well, depending on how much planning that your team also needs to complete. Another budget-related question. If the budget is not approved before 2017, will grantees be required to submit first quarter reports?
Yes.
And just for clarification, not just in GMS, but this is a frequent question for grantees for the PMT reports. it will not be uncommon for you for your first report to be putting in zeros for a lot of the different numbers that are asked in the performance measures reporting system. So it might ask you questions about number of calls for service, for example, or number of people that you've seen, or how many screening and assessment tools you have administered during that previous quarter. So in January, I think it's due at the end of January, when you finalize those reports, it's not going to be uncommon for you to have no activity that's listed at that point, and BJA is completely aware that that is all normal and appropriate for where you are in the grant program.
That's correct.
Nikisha, there's a follow-up question about the financial point of contact on how do you actually assign more than one financial point of contact to ensure that there is responsiveness?
And if they need to go through their grant, yeah,
they have to go through the grants management system.
Which is different than going to Nikisha or Veronica directly. You are able to change that person in the GMS system. You do not need to go through the grant manager in order to do that.
Just to get a little bit more clarification on the budget, another grantee is just a little bit confused. They said that they submitted the budget narrative with their application. Does there need to be an approved budget outside the budget detail in the application they submitted?
No, the budget that they submitted is still under review with OCFO, and if there are no financial issues, then the budget will be approved. If there are any financial findings, then either myself or Veronica will reach out to them to let them know what needs to be revised within the budget.
Fantastic. Thank you, Nikisha. We also had someone ask if this information will be available or if this is recorded. And yes, the webinar is being recorded. A link will be sent out to all grantees after the webinar with the slides as well as a link to the presentation so you can share it with other team members who are unavailable. If you look in the chat box, there has been a link to the Justice Center website and webinars, and it will also be available at that link. So another question that we had is was to go back over when the frequency of when reports are due.
There are multiple reports. If you can answer that between GMS and PMT.
The PMT reports are due quarterly. And the first program progress report in GMS is due quarterly. That first report will be due at the end of January. And each report after that for the programmatic only will be semi-annually. And the financial reporting in GMS is due quarterly. So PMT and the financial status reports are always due quarterly. You will have one quarterly report due for programmatic in GMS, and that's just for the first half of from October to December. And after that, they will be due semi-annually.
And Nikisha, can you just follow up with when or how grantees are contacted about when those reports are due? Do they get an automated message from GMS, yes, or does somebody alert them to that process?
No, an automated email is sent from GMS and from the PMT once they have registered with the once they registered within the PMT. They will get automated emails letting them know that these reports are due. So that's why we ask that all contact information is correct and up to date.
And one thing that Sarah hadn't mentioned yet, but that your TA coordinator will review with you, we are hoping to have another webinar in early December that specifically goes over a lot of the budget and financial aspects of the grants management awards. So giving you a little bit more detail about what needs to go into GMS and where, and how to look up that information, and how to contact all the various players that are on your screen right now, because there's a very big alphabet soup, and not everybody knows who the right person is to contact. So your TA coordinator will be reaching out to you in early December, or actually a little bit before that, to schedule a webinar for the entire cohort that's specific to budget-related matters.
Sarah.
Yes.
Sarah?
Yes.
I wanted to piggyback off of that question that one of the grantees had in regards to drawing down funds. When, when I told them that it is as needed, which means that we don't want them to have it's a cash on hand rule, that if they draw down before and the funds are not used within 10 business days, that will be considered excess cash, and that money will need to be returned to OCFO, to us.
Great. Thank you, Nikisha, for that further clarification. We had another question about when the grantees could expect to hear from the technical assistance coordinators. And you should be expecting to hear from your TA coordinator within the next week. They'll be outreaching to you, and then they'll be sending you potential dates and times to have an introductory phone call to start getting acquainted with your jurisdiction. They'll already have the program narrative, the budget information, but if there's other information that you think would be helpful prior to the first call, please make sure to send that in your responses, as well as confirming dates and times that work for your team members. For the introductory calls, it would be great to have members of your mental health and your criminal justice partners on the line, just so they get a feel for what technical assistance is available for the Justice and Mental Health Collaboration Program grantees. They'll work to set up the technical assistance introductory call with you in either November or early December. There was another question about what is the timeline for completing the P&I guides. So the timeline for completing the P&I guides is trying to work with your TA coordinator to figure out a timeline, but it typically takes between 8 months to 12 months to complete the planning and implementation guide process. And the P&I guides are slightly different for the different grant categories. So there is a different planning and implementation guide for Category 1, which is collaborative counties, and for law enforcement grantees, as well as all of the other planning and implementation grantees. Another question is, what types of topics are discussed on technical assistance calls? So part of that actually varies a little bit depending on the jurisdiction's needs. In the planning and implementation guide, it goes over different key areas for the program. So talking about what your Justice and Mental Health Collaboration Task Force as well as working group looks like, and how you can engage additional stakeholders to really have a well-rounded group who are supporting your project. Screening and assessments for substance use disorders, mental disorders, and co-occurring disorders is a common topic, as well as helping with selection of tools for that. Implementation of evidence-based practices, data collection and evaluation, and also remember that we have a research and evaluation partnership learning community this year as well. And sustainability. Those are kind of very common topics. For law enforcement grantees, there is other conversations about things along the lines of specialized police responses, mental health first aid, and for collaborative county, there is a pretty big focus on the data collection and measurement pieces and what you should be tracking within your jail to make sure you know the number of people that have mental illness, and then how you can better support those individuals. Just a reminder, if you have any questions, please feel free to write them in the chat box on the right side where it says questions and answers.
Another question that just came in was explaining the orientation that's happening in the spring and who should attend and how long is it going to be. If you've been a previous JMHCP grantee, we usually conduct an orientation in Washington, D.C. Once a year for each new cohort of grantees, and then every other year we conduct a fairly large conference. I know that your budgets are all reflective of that. Everyone should have budgeted for 2 separate events. Last year, based on timing, we ended up doing one very, very large conference for all of the cohorts of grantees. But prior to that, we did smaller summits or smaller group meetings that were happening here at the Justice Center offices for small groups of cohorts of grantees. So, for example, law enforcement or mental health courts or juvenile justice, or those grantees that were focusing specifically on co-occurring disorders. We're still in the process of figuring out what that event is going to be looking like. We suspect that that will be happening, the smaller events that will be happening either in Washington, D.C. or potentially here in New York again at the Justice Center offices. It's usually about a day and a half to 2 days and requires about 2 to 4 staff members to attend. It will depend on the location. If it's here in the Justice Center offices, it will be 2 members from each of your programs, and if it's in a different location, because we can't accommodate that many people, depending on how many you budgeted for, it might be up to 4 of each of your staff members. Sarah, another question came in about the learning communities. If you wanted to mention something more about those and who can attend them, and how those are assigned. Do you get to go to all of them, one of them, none of them?
So that actually depends. The different learning communities have different parameters. The Gender Responsive Services for Women Learning Communities we are conducting in partnership with the National Resource Center for Justice-Involved Women, and that is specifically focused for grantees who are serving women in the justice system as part of their population. And women were a priority, justice-involved females were a priority population for the JMHCP solicitation this year. So that is going to be an application process for that learning community, and it'll be about probably 8 or less grantees to really make sure that the community is able to do deeper dives on topics of interest. For the law enforcement learning community, the plan is to have that open to all law enforcement grantees, and they will be introducing you and utilizing the resource of the law enforcement mental health learning sites as a piece of that. So you'll get to learn more about those 6 jurisdictions and what they're doing right now, and really learn from people who have been through the types of work that you're trying to do. The research and evaluation partnership learning community is actually meant to be a paired event with the research or evaluation partner as well as a programs person to discuss different potential outcome measures that you can utilize, how to build a strong partnership, and how a researcher can help you implement quality programming. And that will also be an application process for that community. That also is a priority population within the Justice and Mental Health Collaboration Program solicitation for this year.
And just clarification on that, the research partner Sarah just mentioned is the research partner you as the grantee has contracted with, not necessarily somebody else, but somebody that you wrote into your actual specific grant application.
And the last learning community is on healthcare enrollment and other benefits. And that is going to be open to any grantee who is working through this issues. The first topic will be looking through enrollment practices. So how do you work to enroll people in healthcare coverage such as Medicaid? And there will be other topics that are covered such as Social Security, SSI, SSDI, as well as veterans benefits within that community. So anyone can come and go from that community as the topics are appropriate for that jurisdiction.
Great. There was a specific question about the time frame for the orientation meeting, and that's going to be a little bit staggered. I don't think that they would start any earlier than March, because we are potentially looking at doing multiple small meetings with each of the different culprits. They would occur over a couple of months, so I would suspect March, April, May-ish. As Richard had mentioned earlier and in the presentation, we also operate the National Reentry Resource Center and provide technical assistance to Second Chance Act grantees who will be doing similar events in the spring. So it's a matter of us figuring out what logistical space is available and how that happens. All grantees will be notified at least 2 months in advance so that you're able to clear and get your travel approved. We understand that that needs to be approved by your home jurisdiction and county often, and those funds released to you. So you will be given ample notice of when you can actually travel for one of those events.
Thank you, Cynthia.
There was another question that just came in. If grantees do not factor travel into this grant budget, what will be the process of modifying that budget in time for the orientation? If that's something that you have not factored in, I would suggest that you give a heads up to your TA coordinator on one of your first phone calls with them. You do have enough time to modify the budget at this point, but I would suggest that you start doing that now. And that's something that you would work with your program office person at BJA on to help modify, and it's something that's submitted through GMS. So you will work with your TA coordinator to make sure that you have the funds in order to parcel that out for the travel, and then you would work with either Nikisha or Veronica to put that budget change or GAN, a grant adjustment notice, into GMS in order to set aside the funds for that travel.
Okay. Can I piggyback off of that, Cynthia? I would ask that they do that now while the budgets are still under review, so that it doesn't get approved and then we have to wait for a budget revision or, for that to happen. So it's best for them to go ahead and factor in for that travel cost now, because it should have been done when they did the budget, because it stated that they needed to do that. So I would suggest that they do it now while the budgets are still under review with OCFO.
Great. Thank you. Well, noticing that we're actually at the end of our hour here, I just want to thank Nikisha and Maria, as well as Richard and Cynthia, for answering all the questions on the webinar. If you have any additional questions, the contact information is up on the screen. You can feel free to reach out to any of us, and we should be able to direct you to the right person. And your technical assistance coordinator will be contacting you within the next week, so you can expect to hear from them soon. As you exit the webinar, there will be a short survey that will automatically come up, and there will also be a redirection link to sign up for our newsletter if you're interested. We'll email you the recording for this presentation as well as the PowerPoint slides in the upcoming week. So thank you again. Congratulations on your award, and we look forward to working with you throughout the course of your grant period. Have a great day.